7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show for this Friday, November 2nd, 2018. We're going to be talking a lot about the hip and the knee on this show, and arthritis as well, and some of the new robotic surgery techniques available for the treatment of arthritis. I'm going to welcome to the program Dr. David Padden. Dr. Padden, how are you doing this evening?
I'm doing well. Thanks for having me, Dave.
Thank you, and thanks for making the drive. I know you're here back in the area again at West Boca Medical Center, so we're really glad to have you. I know you have a long time. You've been on staff there a pretty long while, right?
About 18 years.
Whoa.
So 17, 18, yeah.
Well, welcome back to the area. And you have an office. We're going to give out the location address also on the campus. Or no, actually right down the street right now from West Boca Medical Center.
Yeah, on 18th Street, right off Power Line.
Perfect, and I will give out that info as well. Oh, I want to get right into it and talk about what you do. Your medical specialty is orthopedic surgery, but it has morphed into the robotic surgery for the hip and the knee. So tell us a little about what you do and how it can help people across South Florida.
Sure. Let me just go a little bit into the background. You know, I completed my residency in orthopedics in New York City at Downstate Medical Center, Brooklyn, New York. And then I went on and did a fellowship at Johns Hopkins in Baltimore in arthritis and reconstruction, which was essentially total hip and knee of the hip and knee. Fellowship is additional extra training where you spend with a mentor who's one of the tops in the field, and you really focus on those specialties. I was from New York. I always wanted to be down in South Florida. It's pretty much, you know, the next borough. So it was a natural progression for me. I moved here in '98, and at that point I was pretty much a general, doing a lot of general stuff. I kind of realized early on in orthopedics that joint replacement was what I enjoyed doing, because I loved being able to combine the surgical experience with fixing and building and creating things, as well as, of course, helping people, getting them back on their feet, getting them to feel good, etc. I did the fellowship, and as I continued to gain experience practicing, you realize that a lot of the things we did were very old-fashioned and very much old-school technique. I really believed that the future of medicine was going to involve robotics, just as robotics is involved in pretty much almost every other field in manufacturing, etc. And so initially the robotic, the actual robot was created here in South Florida at a company called Mako Surgical, a small company down in Davie.
Spelled Mako like the Mako shark.
Yep, Mako shark, exactly. They wanted to develop a robot to help and assist in doing replacement surgery. The first robotic partial knee replacement in the whole world was done here in South Florida. So initially, this was still fairly infantile in its nature, and most surgeons didn't adapt to it initially. But as I saw the results in the community, I naturally became attracted to it. I really felt there was a need for it in hip replacement, where we do really part of the carpentry completely blind. And so I began learning and helping to develop the hip software and equipment with Mako before it was released to the public. In October of 2011, it was released to the public, and ever since that day, I have not done a single primary hip replacement, meaning the first time somebody has a hip replacement, without a robot. So I've got virtually some of the most experience in the world. I'm also a consultant for Stryker. I teach. I have surgeon visitations who come and experience watching the surgery and watching how we work in the OR and use the software, etc., to both plan and perform the procedure.
Like proctoring in a way?
Yes.
Okay.
And so that ability to use a robot to assist in the performance as well as planning of the procedure is now available in hip replacement, knee replacement, as well as partial knee replacement. So it's amazing what we're able to do today and what we're able to accomplish now with these assistive devices such as robotics.
And the Mako robot now, with other robots, we've talked a lot about the Da Vinci on this show for GI and general surgery. Mm-hmm. But you're able to make some? I guess the word would be rotations or turns that you wouldn't be able to make with our actual hands, our human hands.
Let me kind of explain it. Essentially, part of joint replacement or orthopedics is some of it is carpentry. Mm-hmm. The way we used to plan the carpentry was off an X-ray and with little plastic models that we would place over the X-ray, to gain a sort of size and idea of where you wanted to place these pieces. And then you'd go into surgery and you basically cut and do things by eye. There was no absolute way to measure angles, depths, things like that.
You just really had to know what you were doing.
Right, it was all experience. So, in robotics, we actually obtain a three-dimensional representation of your hip by a CAT scan. We're then able to see every nook and cranny of the bone, how thick it is, how long it is, how short it is, etc. We're able to then place the components in the bone where we want them and position them exactly at the angles and positions we'd like them. And then in surgery, the robot assists us in performing the carpentry so that we hone those positions exactly as we want. And then when we go to position those components, it gives us all the feedback and allows us to place those parts almost to an exact, precise position. Astounding degree of accuracy and precision that we weren't able to ever have before. And I think it's just an incredible time in orthopedics and joint replacement because of these devices that we're now able to utilize.
And this Mako, it's at West Boca Medical Center.
Sure is. It's been there for a few years. I've used it there for several years, and certainly we have all the availability there to do partial knee replacement, total knee replacement, and total hip replacement. I might also add that I do all these surgeries as muscle-sparing approaches as possible. So in the hip, I do not cut any muscles or tendons. In the knee, I minimize the amount of muscle, cutting or moving of the tissues to minimize trauma.
And that makes it, obviously, using a robot, for one, I know from other fields, it will make it minimally invasive. And then what you were saying there as well, that can kind of help to shorter hospital stay, less chance for infection because you're out of the hospital quicker. And like I said, minimally invasive, these robots.
Correct.
Compared to what you used to do beforehand.
Right. The other amazing potentials for these are that they minimize the amount of need for cutting of the bone and bleeding because you're only having to cut once rather than multiple times as we did when we used manual or by our own eye. In addition, one of the largest problems after hip replacement was limb length discrepancy, your legs being too long or short. With the use of robotics, we were able to minimize those discrepancies to degrees that were unprecedented when you're using it, trying to do the surgery on your own. And in addition, the robot ensures that you put these parts in where you had planned them, which hopefully will lead these parts to last for longer and longer periods of time.
Yeah, that's another issue. Is you may have to, you don't want to have, as a patient or individual, you don't want to have the surgery. Sometimes you have to have another surgery if it's the components wear down, but you don't want to have too many during a lifetime. So we're here with Dr. David Padden, orthopedic surgeon, robotic hip and knee and replacement surgery specialist. He's with Tenet Florida Physician Services. Doctor, you said 18th Street, and I got the exact address right here. It's 6853 Southwest 18th Street, Suite M111. So that's M11 in Boca Raton. And Dr. Padden's number is 561-430-4610, and we'll give that out again. Dr. Padden, I wanted to ask you also, is most of the, we talked a lot about hip so far and a little bit about the knee, is most of these ailments that come into your office due to the arthritic hip and knee, this is arthritis over time? Or because I think as the general population, sometimes we think like, they blew their hip out, like we're thinking like an athlete, or they blew their knee out. But a lot of these ailments are being caused by arthritis over time in the joints.
So arthritis is a grab bag term for wearing out of the joint surfaces, kind of like your brake pads on your car are wearing out, right?
They're going to wear out eventually.
So there's different forms. We give names for the arthritis. The names tell you what caused it. So degenerative or osteoarthritis is plain old wear and tear. Too much activity, potentially genetics, increased weight and stress on the joints, etc. If you had been in a car accident, you destroyed your joint, and it was fractured and broken in pieces, that's called post-traumatic. If someone had an infection that ate away at the cartilage, that's called a septic arthritis. So there's various forms. Other people may have a disorder such as rheumatoid arthritis, which may eat away at their own cartilage and lead them to have destruction of the joint. And when the joint is destroyed, which is, again, the term arthritis, which of course leads to pain, stiffness, swelling, deformity, diminished function, quality of life, then after we've tried whatever we can try, anti-inflammatories, limiting activity level, use of assistive devices, supplements, of which there are multiple types available, injection therapies, of which also there are millions available. And of course, the reason why most times in life in medicine there are a lot of things available to treat is because none of them do that great a job at it. None of them cure it. Unfortunately, at this moment in time, as of 2018, November, we cannot cure arthritis. It just can't be cured. So unfortunately, at the end stages, surgery becomes the only option, and a great option to restore you to function quickly now with the muscle-sparing approaches, and to make these surgeries so accurate and precise that we can entertain doing these surgeries on younger and younger populations, because these things will last longer and they won't require the need for multiple surgeries again in the future.
Dr. Padden, hold that thought. This is very interesting, but we're going to take a quick break, and on the other side talk a little bit more with Dr. David Padden about robotic hip and knee replacement surgery on the How to Stay Healthy show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. Welcome back to the program. We're here with Dr. David Padden, orthopedic surgeon, robotic hip and knee replacement surgery specialist here in Boca Raton. He's got an office with Tenet Florida Physician Services and on staff at West Boca Medical Center. Dr. Padden, we talked a lot about the Mako, but what age range of patients do you treat at your practice?
I generally treat patients 18 and above.
Okay.
Certainly those younger populations are not commonly requiring hip or knee replacement yet, and we'll do a number of other things to try to save that joint for as long as possible.
That's great to hear, because it's not always a non-surgical, or it's not always a surgical approach. Orthopedic surgeon like yourself will look at non-surgical options first.
Absolutely. I mean, we do the complete care of the arthritic joint, and that can range from doing nothing, ignoring it, to taking an anti-inflammatory, to using assistive device, to using comfortable shoe wear, to reducing weight, to modifying lifestyle, as we said, to various herbal supplements and various other treatment options available.
So most of the people that you're treating surgically with the Mako, are these the baby boomer age, older? People are living a lot longer than ever. I just saw a presentation by a doctor this morning. He's 83, and I thought he was 63, the way he carried on this morning at a grand rounds.
Interestingly enough, when I first started doing joints, we really didn't do joints on people below the 70s and 80s. It's amazing now, because of the implants' viability and their lasting for long periods of time, and the better and better surgical techniques that we have. We've expanded the indications. I've done them on patients as young as 19, as well as upwards of close to 100, 105. So
oh, wow.
We've
octogenarian, past octogenarian, centenarian. I'm sorry.
Well, there's no reason not to enjoy quality of life. And when you are at the point where you're no longer happy with your functional level, where you're no longer happy with how we can help modify or relieve your discomfort, and you're no longer happy with how well you're functioning, that's when it's time to consider doing these procedures, so that we can give you back your life and get you back to really feeling good again.
Quality of life, we always talk with doctors on this show, and that's very important, because it can make you healthier. The happier you are, the healthier you are in a way, but you have to do other things as well. And That's important. I wanted to ask you also, I'm thinking of things as we're talking because, I'm getting a little older. I'm thinking about my hips and knees and what, the general public would ask if they had a chance to be next to an expert doctor like yourself. And I'm thinking, how long am I going to be out of work if I have a hip surgery with the Mako? We'll start with hip first. What is the general timetable to return to, I guess, like activity like working and then like back to, getting on the golf course or tennis court?
Usually we'll ask the patient to wait about 6 weeks to really get back into full golf swing or tennis swing. Work is variable depending on the job. Obviously, if you have a sedentary type work, you may be able to go back within 2 weeks, 3 weeks. If you have a more vigorous job, which requires more lifting or significant walking or climbing, that might be upwards of 4 to 6 weeks.
That's not bad at all, though.
No, and of course everybody's different, which is what makes people instead of being an automobile part or a BMW, and you put the part in and you just drive off.
You don't think of that. You're not a doctor. You don't think of that. But another part of that is how long are they typically in the hospital for? Is it a few days or?
Interestingly enough, last year my average was about 1.4 days. So most patients are now able to leave the hospital the following day. If we can get you to your own home where you can sleep in your own bed, you can eat your own food, I think always that's the best place for you to recuperate.
That helps with the healing, huh?
Absolutely.
Interesting. What types of components, you talked about implants for the knee and hip, are available in orthopedic surgery today? We're talking, I know I always want to think titanium, but what do you use?
I use Stryker Corporation. I've used them for years. The metal femoral stem, the part that's in the thigh bone, is actually made out of titanium. Most of them now. Some are rarely made out of cobalt chromium. The plastic is made out of a high molecular weight polyethylene. The balls are either ceramic or metal. Mm-hmm. And those are the main component and alloys.
Titanium is very light metal, but you can't really break it or cut it. I mean, it would take something very serious to break or cut a piece of titanium, correct?
It's not as you think.
No,
it's
a lighter metal the way they make it, right?
It is strong, but it is somewhat sensitive to notching. So if it gets any nicks or cuts in it, it does significantly weaken it. Stainless steel has been used, a very high quality stainless steel, for years in orthopedic industry for fixing of fractures and plates and rods. But titanium is generally the main component used in many of these nowadays.
I got to ask you because I'd heard you were coming back to the area, and I had done some research on you online. You know what the typical thing a reporter would do, and I saw a picture of you, and it looked like you were almost in like a space suit. Do you wear that when you're?
Yes, we do.
Is that for to limit infection?
It is absolutely designed to help limit infection. In addition, as we're performing the procedure, especially when you're sawing or drilling in bones, there certainly may be some blood that may get aerosolized into the air, and so that also protects the surgeon and the surgical team as well from any body fluids or contamination.
And I hope I didn't make it sound like space. It's very state-of-the-art. I mean, it's very futuristic is what I was getting to.
Well, I have my TARDIS in the changing room as well.
Oh, wow. There you go. We're here with Dr. David Padden. He's on staff at West Boca Medical Center right here in Boca Raton, part of the Tenet Health Network. Tenet Florida Physician Services is where his office is located. Right now it's at 6853 Southwest 18th Street, Suite M111. So that's M111 in Boca Raton, near the hospital. 561-430-4610 if you have a question for Dr. Padden staff. If you have any questions, if you could be a candidate for our, an arthritic hip or knee replacement. as well. I should say robotic hip or knee replacement. So far since you've been doing the Mako, what is about the percentage of hip versus knee that you do? Or can it vary from year to year? I do
a little bit more hips than knees, but I do a large amount of both.
Okay. And that is that's a knee replacement surgery?
Yes.
Okay.
I also do a fair amount of partial knee replacements. Some patients don't need the full knee. They may get away with a much more minimal surgery in which we make a teeny incision, don't cut any muscles, and just replace the part of the joint that's worn instead of replacing all 3 parts. We replace the single part that's worn only.
I'm smiling because that's
great. Less trauma and a much, much faster recovery for patients.
That's great to hear. Definitely. Well, we got less than 2 minutes, so I'm going to go to the speed round. Why did you become an orthopedic surgeon? We got 1 minute.
I became an orthopedic surgeon because I wanted to be a surgeon. I naturally had this passion for using my hands and operating, and I think really, if you ask most of us doctors, a lot of us knew we wanted to be a doctor since we were young. That's like the standard stock answer. Orthopedics naturally attracted me because, I like the idea of building and constructing and deconstructing and using those skills in the operating theater. Incredible.
Well, Dr. Padden, thank you so much for the information, and we'd love to have you on again.
Thanks for having me, Dave. Anytime.
For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.